I'm Dean Odle, and I approve this message. Recently, Governor Kay Ivey extended her mask mandate on Alabama again. She keeps telling Alabamians to just wear their bloomin' mask. She continues to push the idea that masks work. But we have to ask the question, does science say the mask work? We know CNN says it. We know that Fauci kind of says it. But do they really work? If we go and look at the scientific studies, especially this one going back to 1981, this scientific study, as you will see, is at nih.gov. That is, of course, Anthony Fauci's organization, the National Institutes of Health. This was published in 1981 in the Annals of the Royal College of Surgeons of England. Is a mask necessary in the operating theater? If you'll notice that down here in the summary of this study that went on for quite a few months, it says no masks were worn in one operating theater for 6 months. There was no increase in the incidence of wound infection. This study goes on to talk about that. As you can see on this page, they said there was no initial rise in infection, so the trial was continued and the results presented for the 6 months March to August. There was no increase in wound infections when masks were discarded in 1980. In fact, there was a significant decrease. So what we found out from this study was that masks did not stop infections. They did not increase, the lack of masks did not increase infections. In fact, there was a decrease of infections in surgery. This is a peer-reviewed, published scientific study that was done for a number of years, I believe it was, over 5 years. Here is an article at cdc.gov called the Non-Pharmaceutical Measures for Pandemic Influenza in Non-Healthcare Settings, Personal Protective and Environmental Measures. As you can see down here, it says, although mechanistic studies support the potential effect of hand hygiene or face mask, evidence from 14 randomized controlled trials of these measures did not support a substantial effect on transmission of laboratory-confirmed influenza. In other words, 14 randomized control studies did not show any difference between mask or no mask. These are scientific studies. Again, cdc.gov. Going down further, it's very clear here. It says, in our systematic review, we identified 10 random controlled tests that reported estimates of the effectiveness of face masks in reducing laboratory-confirmed influenza virus infections in the community from literature published during 1946 to 2018. In pooled analysis, we found no significant reduction in influenza transmission, which is, of course, an airborne virus, with the use of face masks. So face masks did not help. Here we have an article from the Center for Evidence-Based Medicine. If you notice out to the side, the stamp of the University of Oxford. This is mainstream medicine, mainstream science. The article is entitled Masking Lack of Evidence with Politics. This was put out July 23rd, 2020, during the alleged pandemic. Let's see what it says. It says here, despite the clear requirement to carry out further large pragmatic trials a decade later, only 6 have been published, 5 in healthcare workers and 1 in pilgrims. This recent crop of trials added 9,112 participants to the total randomized denominator of 13,259 and showed that masks alone have no significant effect in interrupting the spread of influenza-like illness or influenza in the general population, nor in healthcare workers. Let me read that again. This study, these recent crop of trials, as it says here, showed that masks alone have no significant effect in interrupting the spread of influenza-like illness, airborne viruses, or influenza in the general population, nor in healthcare workers. This trial found that the rates of these influenza-like illnesses were 13 times higher in Vietnamese hospital workers allocated to cloth masks compared to medical and surgical masks, so cloth masks, are worse, and it's over 3 times higher when compared to that of no mask. So people who wore masks were more susceptible to getting the infection. This is consistent with what we saw with the study from 1981. Here we have the study that was pushed by the fake news media. It was called Decrease in Hospitalizations for COVID-19 After Mask Mandates in 1,083 U.S. Counties. This study was done in the midst of the pandemic, but had to be recently withdrawn. The authors have withdrawn this manuscript because there are increased rates of SARS-CoV-2 cases in areas that were originally analyzed in this study. So the one study pushed by the media that masks help decrease hospitalizations from COVID-19 has been withdrawn. That couldn't be clearer. So there is not really a leg to stand on here. Here we have an article from The Blaze. Horowitz here says, from Fort Benning to Japan and Hawaii, face masks are not working. Even following protocols in the military didn't stop the coronavirus from spreading. The article goes on to say one will not find a greater degree of compliance to a mask mandate than with one placed on military trainees by drill sergeants. That's why if masks are really the viral placebo their devoted cult worshippers make them out to be, one would expect mask mandates to work wonders in these environments, except they didn't work. Just like they didn't work in Japan, Hawaii, Israel, California, Miami, or any other place where they've been shown near universal compliance for months. Yet the virus spread rapidly. In other words, mask did not work even with military drill sergeants making trainees adhere to the protocol. The article goes on to say in the military, they don't just virtue signal and wear masks as a symbol. If they are led to believe mask wearing will work to stop the spread, they will wear them seriously with the boot of the drill sergeant behind them. Yet despite universal mask wearing, the super social distance rituals, and all precautions imaginable, it failed to stop an outbreak at Fort Benning in Georgia in May, which is right near here where I live in Opelika, Alabama. Another important observation from this Fort Benning outbreak is in order. Notice how the mask did not help and the virus spread far and wide, but stopped at the 22% threshold. This is another great example of what Nobel laureate Michael Levitt, Oxford epidemiologist Sunatra Gupta, and Stanford professor John Ioannidis predicted early on based on the natural case study of the Diamond Princess cruise ship outbreak, that the virus hits a brick wall in most places around the 15 to 20% marker. 17% of the passengers on the Diamond Princess tested positive. The working theory is that most people have some degree of cross-immunity from other coronavirus colds, and that the virus does not transmit homogeneously from every infected individual. In another article from Austria, we find out that compulsory masks did not bring any measurable benefits in Austria. Professor Dr. Franz Alleberger speaks plainly in the most important news program in the country. The head of the public health department at Aegis, the infectiologist Franz Alleberger, spoke in an interview with ZIB2 about the effect of the mask obligation. His conclusion, the obligation to wear masks, like its abolition, had no measurable effect on the contagion situation in Austria. Here, an article from the Foundation for Economic Education. Europe's top health officials say masks aren't helpful in beating COVID-19. The top medical experts in the world can't decide if masks are helpful in reducing the spread of COVID-19 or they just make things worse. This was August 6th of 2020. Here we have the medical care minister Tamara van Ark of Denmark. She says, from a medical point of view, there is no evidence of a medical effect of wearing face masks, so we decided not to impose a national obligation. Could that be more clear? Here we have a doctor, the medical care minister of Denmark, saying that there is no evidence of a medical effect of wearing a face mask, so we decided not to impose a national obligation. In Sweden, the Swedish top scientist warns against relying on masks to stop COVID-19. We have here the Dutch saying face masks are not necessary and could even harm the fight against coronavirus, say Holland's top scientist. We can keep going on. Holland's top scientists say there's no evidence face masks work and may actually cause more harm. This is consistent with what we saw in the study back in 1981 in the CDC and so forth. It is consistently the science that masks don't work and can make things worse, make you more susceptible to getting the infection, getting the virus. So why are our politicians pushing this? We go to Cohen Barons here. He's the spokesman for the National Institute for Public Health and the Environment. And he says, and this is in Holland, he says face masks in public places are not necessary. Based on all the current evidence, he says there is no benefit and there may even be a negative impact. What are we doing? Now, we saw in Kansas, for instance, that there was a graph when the mandates went down, and in Kansas they actually had counties that did not have mask mandates and some that did. And what we discovered when the governor quit the deception and actually showed where the mask mandates started, and going back all the way into June, you found out that the counties without mask mandates did far better than the counties with mask mandates when it came to daily cases of COVID-19. This is just stunning. We see the same thing when you compare Israel to Sweden. Israel began to have very strict lockdown, widespread additional restrictions on July the 6th, and you see that the COVID-19 shot up. Yet in Sweden, where there was no lockdown and no mask mandates, you see that there was no upsurge in COVID-19 cases. So we see here again, Sweden with no mask mandates, no lockdown, doing better than Israel with very strict lockdown and mask mandates. So again, the data doesn't lie. We see the same thing when you compare Los Angeles to Sweden. You see the mandates, the heavy shutdowns in Los Angeles, and COVID-19 going through the roof. Sweden having a little peak, but leveling out and doing far better all the way across from March to September, doing far better than Los Angeles, California, with their strict mask mandates and shutdowns. The Blaze here talks about comprehensive analysis of 50 states shows greater spread of coronavirus with mask mandates. How long do our politicians get to ignore the results? We see this in Florida as well. Florida counties, there were counties that had mask mandates and there were counties that did not. And again, the counties that had no mask mandate did far better than, and lower case rates and lower case growth in counties with no mask mandate versus the ones who did have the mandate. So the results from the states, when comparing states with mandates versus those without, or periods of times within a state with a mandate versus without, there is absolutely no evidence the mask mandate worked to slow the spread one iota. In total, in the states that had a mandate in effect, there were 9,605,256 confirmed COVID cases, over 5,907 total days, an average of 27 cases per 100,000 per day. When states did not have a statewide order, which includes the states that never had them and the period of time masking states did not have the mandate in place, there were 5,781,716 cases, over 5,772 total days, averaging 17 cases per 100,000 people per day. So we have 10 less cases of COVID in states where there was no mask mandate. Folks, proven again and again that the mask do not work. That is the science. But one of the most troubling things about this mask mandate, and the people who know the truth versus the ones who are continually brainwashed by the media and by our current governor, we have people being pitted against each other. It is divisive. It's causing confrontations. It's causing hate. In Huntsville, we have, for instance, Mask Up Huntsville. We have people actually going around to businesses, Dollar Generals, restaurants. They're going around and basically giving grades to these businesses on their COVID mandate adherence, and telling people not to go to these businesses, even harassing some businesses by phone. It is unbelievable as we see this with this group, Mask Up Huntsville. It's troubling. We see here, Biden supporters in this group, Mask Up Huntsville, just attacking like Tractor Supply Company. Here's a restaurant in downtown. It said, "Not a mask in sight," in the kitchen staff. When asked, they said, "It gets hot back here." And so they were telling people, don't go to this restaurant. They were even Krispy Kreme they attacked. It is really becoming ridiculous. And here we have a journalist, and in fact, a New York Times best-selling author journalist, who stated, "I want to find an anti-masker and beat them to death. You effing Christians are what Jesus condemns." This was on January 1st, just a couple of weeks ago. On New Year's Eve, left-wing journalist and New York Times best-selling author Kurt Eichenwald wished pain and misery on Republicans and said he wants to find an anti-masker and beat them to death. This is what's going on. Here's the actual tweet he said here, and he's got as his middle name in his Twitter, Kurt Mask Saves Lives Eichenberg, or whatever his name is. He says here, "It's at a moment like this that I want to find an anti-masker and beat them to death. Since they believe they have the right to kill others, they have surrendered any right to object." This is the level of lunacy that we get when we don't adhere to the science, when we go by media propaganda and deep state liars like Dr. Anthony Fauci and Dr. Birx. We have got to get back to the truth. We have got to start looking outside the box and stop listening to the liberal, left-wing, fake news media and even politicians who are duped by even deep state individuals in our healthcare system, in our healthcare institutions. I'm just amazed. I'm appalled at the doctors and the politicians who will not listen to the actual science. We have to stop this mask wearing mandates because they make you more susceptible to getting the virus, and they are dividing us. This is ridiculous. Our politicians need to lead by example, meaning they need to know the truth. They need to research the truth. They need to stop this unnecessary control and this unnecessary violations of our freedoms, especially when it comes to our medical choices for our health. And if Governor Kay Ivey is so sure the mask worked, then why wasn't she wearing a mask back around Thanksgiving around all these school children? Notice they had on their mask, but yet the Governor Kay Ivey of Alabama, did not have on her mask, and this other woman didn't have on a mask around these school children. Where's the outrage? Is this hypocrisy? I believe it is. Folks, the masks don't work, and let's especially get these masks off of our children right now.